Hello everyone, welcome back to our channel, and for today's video we are going to discuss another DOH program, which is your Environmental Health and Sanitation Program of the Philippines. Environmental Health and Sanitation Program is an important concept in the practice of community health nursing, since we are trying to address the problems that have caused mortality and morbidity in the community as a whole. According to the Book of Cuevas, or the Department of Health Public Health Nursing Practice in the Philippines, or also known as the White Book, okay, environmental health and sanitation is still a health problems in the country. And that is why your environmental health and sanitation program is created, that is used to address the top leading cause of morbidity or illnesses among the general population, which is your diarrheal diseases. And when I talk about diarrheal diseases, guys, we are not just referring to one single cause, because when I talk about diarrhea, there are a lot of things that may cause diarrhea. This includes now viruses, bacteria, and even parasites. So like, for example, conditions or diseases like your typhoid fever, cholera, dysentery, and the likes. And these conditions are the most common cause because we are living in a third world country that poor sanitation and environmental health is really evident, from the disposal of proper garbage to the practices that we are doing at home in terms of handling the foods, and even some food establishment that is violating the protocols that they have to follow whenever they're serving foods to the general population. That is why diarrheal disease is a common condition, and even added to the IMCI protocol, because most of the population that's affected by diarrheal conditions are children. And if not treated well, it may lead to dehydration, then eventually death. That is why the government had created the Environmental Health and Sanitation Program to address these things to happen. Now, what is the legal basis of this program? Why is it created? This is based on Presidential Decree 856, or the Comprehensive Sanitation Code of the Philippines, or the Sanitation Code of the Philippines, commonly known, okay, wherein we are mandated to address the problems in the community. And the sanitation program, when it was created, was actually to address Millennium Developmental Goal number 7, or your environmental sanitation. And your SDG, or Sustainable Developmental Goal, it is still included as one of the indicators. Okay, again, let me repeat that. That is MDG number 7, or Millennium Developmental Goal number 7, environmental sanitation. Now, let's go into details. When I talk about environmental sanitation, we are talking about two things. Number one is the approved type and the non-approved type of water resources or facility. And the second one is the approved type of toilet facility. So we're going to discuss this separately. Let's start first with the approved type, okay, of water supply under the sanitation program. For the approved type of water supply under the sanitation program, we have three classification or categories. Okay, the DOH created certain policies in order for us to follow, or all government or LGU, local government units, should follow in the creation of this water facility. What are those policies? Number one, the approved types of water facility should be known. Then approved type should also be known to everyone, and the access to safe and potable drinking water that is designed to address the problem in terms of diarrheal conditions, water quality and monitoring surveillance, especially for far-flung areas, and the water works and water system and well constructions. All of these comes with policies and regulations that all local government units and even individuals that is trying to build water facilities should follow. So let's start discussing the approved water supplies. Number one, we have your level one, or also known as your point source. Point source is a approved water supply wherein it is protect. Example of this is a protected well in a developed springs with or without outlet distribution. It can actually serve 15 to 25 household at max, and the water supply should be created 250 meters far from the farthest house. Okay, and usually this water supply facility can sustain water source for about 40 to 140 liters per household. So this is the first level, and according to studies, with regards to the three levels of water approved facility, this is the most common cause, or that may be linked to diarrheal conditions, because even though it is an approved water supply, this water source can easily be contaminated. The second water source is the level 2, which is also known as your communal faucet system or the stand post. So commonly we know this in the Philippines as your gripo, okay, or your bomba. So a source reservoir with pipe distribution networks and communal faucet that should be created not more than 25 meters away from the furthest house. So it can actually serve about an average of 100 households, and for 4 to 6 household, um, a one connected system or per a faucet will be serving those 4 to 6 household. So for example, if it's 100 household that it can be supplied with clean water, you have to divide that about 4 to 6, and each household, I mean each 4 to 6 households would have one faucet that would deliver water to this particular household, and it can actually deliver up to 40 to 80 liters of water per day to each of the households. And the third one, the approved type facility, water facility, is the level 3, which is the waterworks system or the individual household connections. Individual household connections, so basically these are the waterworks system that is connected to a centralized system. Like for example, here in Baguio City, we have the Bawadi or the Baguio Water District in Manila. They have the um, Nawasa or Maynilad. So those are yung tinatawag natin, or those are what we call your waterworks system that supplies water to each of the households, and they come with meters so that they can measure how many water this particular household consume, and that would be the basis of how much will they pay. The source and reservoir, pipe distribution network, and household tops, in it commonly available in densely populated urban areas, and this requires minimum treatment and disinfection, meaning to say this is the safest source of water in terms of approved water supplies. And also, since we have the approved water supplies, we also have other supplies but are considered unapproved. This includes your doubtful sources, that includes your dug wells, unimproved springs, and wells that needs priming. And these are resources that are more common to develop the aerial conditions. And commonly, this can be seen to far-flung areas, okay, or areas away from the urbanized community. So that is the water supply facility. For the second one, still under your environmental and sanitation program, we have the proper excreta and sewerage disposal program. So your proper excreta and sewerage disposal program includes now the approved type of toilet facilities. For the toilet facilities, we have your level 1 or the non-water carriage toilet facility, wherein it can be a non-water carriage or the use of small water carriage. So for the no water non-water carriage or the no, these are example of uh, um, uh, approved toilet facility that does not require water, okay, to dispose the excreta. So example of this is your pit latrines, red odorless earth closet, or the ones that we actually use by just putting some soil in combination with other composed materials to cover the fecal matter. The other one is the use of small amount, wherein we use only a small amount of fluid or water to dispose the fecal matter. Example of this is the poor flush toilet and the aqua previs, which is commonly used in far-flung areas. Okay, your level 1 toilet facility. The level 2 toilet facility stands for the water carriage type with water sealed and flush type with own septic tank and disposal facilities. Meaning the disposal is actually owned by the particular household, and all they have to do is to dig and create their own septic tank, and that septic tank is considered as sealed. and needs to be siphoned every couple of years because it has a tendency to become full. Okay, that's a problem with level 2. Unlike with level 3, for level 3, it is your water carriage type connected to septic tank, and also connected to sewerage system that would go directly to the treatment plant. So basically, the water here will be recycled, okay, into a treatment facility before the water will be released to a water works or water or to a body of water such as river and so on. Okay, and this is actually the most advanced type of water facility that is commonly used by urban communities because they will be able to recycle the water. This type of approved facilities commonly done or being used in progressive countries like your Singapore, wherein they actually, since the Singapore is actually a small country, they try to recycle the water that they have because they have limited resources, and so far they have been successful in doing it. Okay, so again, in terms of approved water facility, we have three levels. We have your level 1, level 2, and level 3. We have level 1, your point source. Level 2, your stand post. And your level 3 is your waterworks system. While on your approved type of toilet facility, we have level 1. Level 1 is the non-water carriage to little amount of water. The water carriage with own septic tank that is sealed, and the non-sealed, which is connected to a sewerage system or treatment plant, which is your level 3. All of these needs to be followed by each of the local government unit or any individual that would try to create their own sources of water and their own toilet facility, and they have to follow the DOH guidelines and policies that have set rules and regulations in creating such facilities. So if you do want to, if you did like this video, don't forget to subscribe, hit the like button, and share this video to your friends or nurses. And thank you for watching. See you on my next video.